Right now, we want to welcome back Dr. Stephen Thomas, Division Chief of Infectious Diseases at Upstate Medical University. Thanks so much for being with us again this week, Doctor.
Hi, how are you?
We're doing okay. Well, we know how important information is, helping us to calibrate our behavior, of course. So if you could first share your expertise, your assessment exactly of where we are at with this virus here in our community.
So I think the first question to ask is whether or not there is still virus being transmitted in the community. And the answer to that is absolutely. So we still have new cases that occur every day. We still have active cases every day. And unfortunately, we still have people dying from the infection. But the second question to ask, which is really the basis for a lot of these metrics that the Department of Health has put on the different regions and to distinguish whether they can open or not, is, what is the pace of those new infections? And with the pace of those new infections, is the healthcare infrastructure going to be able to kind of stay ahead of those infections, still care for those people, still care for the non-COVID patients who need to be cared for? And as you heard today from the governor, Central New York has met those requirements.
Right, so I guess that's where we take the deep breaths. So we made it. Central New York can begin to reopen starting tomorrow. And I got to ask you this, Doctor. People hear reopening, so it signals to them, oh, okay, I can go out and I can do things. What do you want to say to thinking like that?
So they should absolutely read the New York State Department of Health plan for reopening, and because the first thing they'll notice is that it's split into different phases, and it's split into phases for a very specific reason. And that reason is that reopening has to occur in a very low and slow fashion. And so you're going to reopen a certain sector of business and a certain sector of society. We're going to see how it goes for a little bit. We're going to reassess where we are. If we're able to, then we'll go on to the next phase. If not, we may have to hit pause, or hopefully we won't have to go back to being closed again. So it occurs low and slow, and it is still going to require that the individual citizen do their part to try and reduce the transmission of virus or the spread of virus from person to person. And so the things that you and I have been talking about for the last 3 months still apply, which would be hand hygiene, respiratory hygiene. If you're sick, you don't go into a public place or go around other people. You should still be avoiding groups of people. And I personally think that you should still be wearing a mask when you're outside of your family unit.
All right, I hope everybody's listening. So much has changed about this virus. We don't need masks. We need to wear masks. Doesn't impact children. It does impact children. Is there more to learn for you than what you've already learned about this virus?
Well, we still don't know a lot more than we actually do know. So we're still learning every day. Because I'm looking at all the new medical literature and the results of experiments and whatnot that are being reported. We still don't have a completely comprehensive understanding of how this virus is transmitted from person to person, and what all those risk factors may be. So that's the first point. The second point is we still don't understand, once you are infected, how long are you infectious to somebody else? So we see lots of reports in the lay press and even in the scientific literature about people testing positive and continuing to test positive long after they feel clinically better. We don't really understand whether those tests indicate someone is still infectious or whether it just tests that there's dead virus, still within the person's nose. And those are two different things. As you mentioned with the children, we still don't understand the complete spectrum of illness that this disease can cause. So all of this basically says that we need to continue to explore, we need to continue to do experimentation, we need to continue to be very observant, and we need to respect this virus, because again, we don't know a lot more than we do know.
And we need to keep listening to you. One more quick question out. We know that university is running some experiments on the drug hydroxychloroquine, and the study's trying to determine whether it can help patients before they get sick, right?
Yeah, so we have a number of studies that are ongoing. We actually have 3 studies that are ongoing that involve hydroxychloroquine. So the first is a study that looks at treating people in the hospital. That's the first study. The second study is looking at trying to prevent infection in people who may have been exposed to somebody with COVID. And so that's called an exposure prophylaxis study. And then the third study looks at treating people who are infected but are mildly ill and can be treated as outpatients. That second and third study are being done in cooperation with the Bill and Melinda Gates Foundation and the University of Washington. We continue to work on the convalescent plasma, which we've reported on your show in the past. And then we have some other studies which I can't give you the details yet, but they're exciting studies. They're going to be exciting for the region, and they're going to be starting soon. Oh. And I think the take-home point of all that is that, this is the benefit of having an academic medical center, an academic medical university within the region, is that we kind of had this tripartite mission, which is to educate new doctors and new medical professionals to care for our patients and to do clinical research so that we can bring state-of-the-art therapies to the region.
Well, we can't wait to hear more about that research, which it sounds exciting and hopefully very promising. Dr. Stephen Thomas, we so appreciate your team and what you are doing, and thank you so much for your guidance.
Thanks for having me.
For more on the coronavirus, including reopening criteria, head to localaspire.com and the News Channel 9 app. Click on the coronavirus banner. You'll find it right on the homepage.